So next we have Ahmad Al Hidiq, who is going to come and speak with us a little bit further with regard to connecting patients globally. So as we've talked about the financial outcomes, we've talked about the value that good quality and good services can bring. What we also are starting to see is that we're shopping more for our healthcare when we can. And as technology continues to enable connections and enable us to come together, as patients, we should have an opportunity to actually choose who we're going to be seeing for a particular service. And that's not just worldwide or flying from one country to another. That should be also in our own local communities. So it'll be revolutionizing our rural care as well as the care that you might have in cities, and just bringing patients and doctors together.
Thank you. Hello everyone, my name is Ahmad. I'm the co-founder of HeyDoc. But before we get into that, I would like to introduce you to Faye. So Faye works a lot on her laptop. She spends a lot of time on her smartphone. And recently she's been struggling with pain in her wrist. Now, Faye really hates going to the hospital. She does not like getting stuck in traffic, sitting in queues, and waiting to book an appointment. So Faye did what most of us would do, and she went online and she started reading through pages and pages of medical journals, websites, and she was trying to figure out what was wrong with her. And Faye was shocked to find out she had one of two things. She had this rare disease in her hand and she had to chop it off, or she had cancer. And obviously Faye now is struggling with an ulcer because of all of this anxiety. Now, the story of Faye is the story of us all. We all hate going to the hospital when we have an urgent health issue, and the reason is because we have access to data, and at the same time, because getting an appointment in North America, in Europe, in the UK, sometimes takes between 2 to 4 weeks. Sitting in a waiting room, waiting for the doctor, takes between 60 to 90 minutes, and this is the average. And it's not right. People have access to data, and they can sort of go online and try to figure out what's wrong with them, but the problem with that is it leads to anxiety. So what patients want is a doctor on demand, someone they could rely on when they have an urgent health issue. They want a tailored, unique solution for them. They are unique human beings. They are patients with unique problems. And they want access to a highly qualified network of doctors that can help relieve them from this anxiety and from this stress and help treat these issues that they struggle with. And finally, they want to save time. So, we are looking at a patient-centered medicine. Healthcare is becoming democratized. So we, as patients, we've got an increased access to technology. And from it, we are able to manage our own healthcare. We can go online and we can look for solutions and try to treat ourselves when we have these little minor issues. And at the same time, when something is not minor or it's not minor anymore, we need to be able to go outside and get advice whenever necessary. And with the support of mobile technology, which has become the center and the future of medicine, we are able to build, or we are witnessing an ecosystem of solutions built through smartphones, wearable devices, apps, sensors that are artificially intelligent, that can help with symptom checking, that can help with diagnosis of certain issues, and then connect us to the right specialist, that is integrated with different wearable devices and diagnostic tools, providing people with access to sensors that can show us our glucose levels, monitor our heartbeats. Even there are sensors that can generate cardiograms that you can share with your doctors. And that's the whole point. I can sort of monitor what's going on with me. Instead of going to the doctor and seeing them physically, I can monitor what's going on with me, and through these sensors, I can share them in real time. And they want access to their own patient profile, their own history of medical records. It's their own data. They paid for it. They should have access to it, and they should be able to own it. And then they should be able to communicate with doctors through different methods of technologies. One idea is virtual reality treatment. So I can put on my headset, I select the environment that I like, I can put on the music that I want, and I can transport to a hammock in Honolulu and have a chat with my therapist. So all of these methods are now coming up and allowing patients to communicate with their doctors in so many different ways that are easy for them. And thus, be able to summon a doctor whenever they have any minor or any health issue. Thus, potentially reducing the amount of time or the amount of physical visits and appointments with doctors. Now, all of these technologies and this ecosystem, which is currently spread across different silos and each of them is popping up by itself, we're witnessing an ecosystem that's being built. But the problem with it is doctors, on the other hand, are facing an immense and overwhelming amount of data. So they've got thousands of patients that they see or treat, but at the same time, they're getting all this data from them, and it's difficult for them to process and analyze it. So in order to solve this problem and to make their life easier, what we need is AI, and artificial intelligence, and machine learning solutions that can come in, streamline this data, and make contextual data or information out of it to be able to share it with the doctor. Solutions that can monitor the patients, send them proactive reminders and tips that will sort of help them throughout their journey, and then notify a doctor whenever something wrong goes or happens. Notify the doctor that this patient requires your immediate care or attention or intervention. So this is where these kind of intelligent solutions come in to help process this data that's coming from patients and then process it towards the doctors and create this communication between them. And this is exactly what we're doing at HeyDoc. We're a global and award-winning health communications platform that connects patients anywhere in the world with doctors globally for the purpose of non-urgent medical advice. Getting on board is quite easy. You install the app, check out a doctor's profile, initiate a request, and start chatting. That's it. And it costs the patient, on average, between 20 to 40 US dollars. And it's built on top of our own proprietary framework, codenamed HeyConnect, that supports text, media, voice notes, and video notes. What we learned from our patients is they like this kind of seamless, non-real-time communication that WhatsApp offers. So we learned that this kind of communication makes their life easier, but at the same time connecting it with this ecosystem of artificial intelligence, wearable devices, and providing them with a online patient record system that's private and secure, and always be providing them with different methods of communication to make that process easy. In addition to that, we are also working on democratizing healthcare even more by launching a new initiative. Now, our goal is those who can afford to pay for it will, but those who can't won't have to. So we launched Salamba, which means wish you good health in Arabic. That's a free, holistic, multilingual, and secure platform that aims at connecting disadvantaged people in refugee camps, developing countries, and rural areas by connecting them to highly qualified specialists and doctors for free healthcare advice. According to the MSF, in 2016 alone, there was over 10 million people that were forced out of their homes due to persecution. That's over 28,000 people every day. There are not enough doctors in Africa. In some places, it's 14 doctors for every 1 million people. We've got over 4 million Syrian refugees in Jordan, Lebanon, and Turkey alone. And 20% of doctors are serving 72% of the population in rural India. And we've all seen what's been happening to Rohingya Muslims the past year. To all of these people, their right is to access free healthcare. It's something that they deserve. And we will make it happen because Salah and I, my partner, we're the co-founders of HeyDoc. We spent the last 4 years in health tech, and this is our 4th startup together. And we're supported by Man, who's our advisor, angel investor, and biggest supporter. And we've got an amazing team behind us to help make all of this happen. And we've been very fortunate over the past year to have a lot of recognition and won quite a few awards within the health tech and startup scene. And we're very excited about HeyDoc. We should be launching next month, and hopefully you guys are too. Thank you very much.
Thank you, Ahmed. Questions?
How do you address the regulatory concerns? Because, patients are supposed to be treated and consulted by doctors registered in the certain country and territory. And by country, the regulation varies, but at least in the Dubai and the UAE, I think that's the case. How do you address that issue?
Well, the goal is to address non-urgent health issues, which range between 60 to 78% of all cases. And when it comes to non-urgent health issues that do not require prescribed medicine, the regulation there's no problem. Because in the end, the doctor is not treating you for a serious illness, they're not prescribing medicine, they're just advising. And this is something that's already happening in our lives. People use WhatsApp, they use phone calls, Skype to speak to doctors. What we're doing is we're streamlining this communication, which is already happening in a private and secure manner, providing them with data that are stored in a secure manner, so that they can sort of help them out.
In the usual manner, no data is documented. So using HeyDoc, all communication is documented. So if, God forbid, something did happen, you can go back to the history, to the logs and all that stuff to just prove any malpractice or any issues that happened.
Thank you. Okay, just a little.
So thank you for the presentation. It was really, really good. I have a question regarding payment of services. Is there a plan for insurance providers to start covering any of these e-visits in the future? I don't know if it's currently happening, but is that going to happen in the future as well?
Well, currently there's a few telemedicine platforms that are covered under insurance. The first law of insurance is for you to be able to claim any kind of advisory, the doctor and the patient should be in the same country. In our case, that's not the case. You could be speaking to a pediatrician in London, for example. Someone in Germany could speak to a dermatologist in Thailand. So this is the kind of communication. Until that happens, and we're talking to different insurance bodies, until that happens, that wouldn't be covered. And at this point, it's purely payment for advisory without insurance.
Thank you, Ahmed, very much. Great presentation. Hey, Doc.
Thank you.